Hi, I am Rajesh Verma, orthopedic and endoscopic spine surgeon. This is in continuation of our previous talk on annular tears, where we had discussed about the cause of annular tears, how to diagnose them, and what are the problems which happen because of annular tears, and why some annular tears are so painful. As we discussed, there can be a mechanical cause because of loose fragment, there could be some chemical reactions, there could be some immunological phenomena, and there can be some vascular ingrowth into the annular tears that leads to lots of pain. So now question arises, how to treat these annular tears? So these annular tears, many times they are pain-free, only few of them are painful. So the precise part of the treatment, I would again reiterate, is to make a correct diagnosis. So how to make that correct diagnosis? I will spend a minute over that again. We always employ a technique which is known as functional pain mapping or spinal pain mapping, where we put a small needle into the disc and we inject a dye along with some local anesthetic. And if a patient has a concordant pain means the same pain which patient used to have before this injection, and if patient has complete relief of that pain, and if he goes into those movements like bending, twisting, and the pain completely disappears, if not completely, I always say at least 70 to 80% of pain relief should be there with that injection, then we term this pain as a concordant pain. So first part of any treatment, whether it is medical management, whether it's a surgical management, whether it's a physiotherapy, first part of any management has to be a correct diagnosis. So our team focus a lot of time on correct diagnosis, and to reach to that level, whatever energy, whatever effort we may have to put, we work as a team. It's a team of 4 spine surgeons which put their intelligence together, and we always try to reach to a correct diagnosis. So first step is a correct and complete diagnosis of the pain. Once a complete and correct diagnosis has been made, there are certain and many ways to treat one single thing. First way to treat is wait and watch, because we have learned from our practice, and also there are plenty of scientific evidence that these annular tears, they can heal. If not heal completely, they can heal partially and become pain-free over a period of time. So good way to wait and watch is that around 18 months of time, 60 to 70% of annular tears become pain-free. During this time, if patient is taking some pain medications, anti-inflammatory, some heat, also physio modalities like interferential therapy, TENS, and various types of mobilization, manipulation, strengthening of muscles, strengthening of core muscles, abdominal muscles, these all things make a complete package of conservative treatment, and we should always wait and watch and use conservative treatment before embarking upon the second thing. So next step in the ladder of treatment is injections. As I told you before, that we give injections inside the disc to diagnose it, and at the same time we put a small amount of steroid into the disc or carbopapain, which used earlier in our education time, but now we don't use carbopapain because it is found to create so many bad effects also. Nowadays we use platelet-rich plasma or stem cells or glucosamine sulfate, chondroitin sulfate. We mix all these things together and we inject inside the disc. Very small amount is injected, around 0.5 to 1 ml, and that helps in healing of the annular tears. Also it neutralizes the chemical atmosphere which has happened because of the chemical and immunological phenomena. So once those chemicals are diluted, and there can be some healing because of PRP or stem cells, patients feel wonderful. Up to 60 to 70% chances are there, their pain may disappear. But what typically we do at our hospital nowadays is to utilize endoscopic spine surgery, where we put a small cannula around 8 millimeter diameter. It's the size of just a stapler pin. Very small diameter cannula is put inside the disc, and we try to coagulate the annular tear utilizing a nucleoplasty technique, or nowadays we are using lasers also. This works in all the ways. Like when we put a cannula inside the disc, there is always a possibility that with a small punch you can remove the loose fragments. As we know, these loose fragments of the nucleus pulposus, they are the cause of the chemical and immunological reactions. Once that fragment is taken out with the help of endoscope, the cause of the chemical and immunological phenomena is taken out, and then healing can be spontaneous. Also, at the same time, with a small radiofrequency needle or a coagulation cautery, we burn that area inside the annulus, which kills the small nerves which is responsible for pain, and then the second part of the cause of pain because of angiogenesis and vascularity is taken care of. And also we enter into the spinal canal through the same approach, and we burn the sinovertebral nerve or the redness which is happening in front of the epidural canal or the cauda equina. That takes care of the vascular phenomena also. So this is the best type of treatment which is utilized nowadays. And if some patient is having severe pain and is not getting relief, and you are not well versed with endoscopic techniques, then we have seen patients undergoing big surgeries like spinal fusion surgery. In spinal fusion surgery, you do not take care of the annular tear, but you remove whole of the annulus, replace whole of the disc with a spacer, and fix with 4 or 6 screws depending on the levels. I would say this is an overkill to treat a small problem. So I do not personally perform spinal fusion surgeries for annular tears, but yes, all other things when employed correctly and wisely in a selected group of patients can lead to up to 80 to 90% of pain relief. And how to prevent these annular tears becoming symptomatic? We have to undergo lots of exercises. Physical therapy is extremely important. You have to strengthen your abdominal muscles, back muscles, core muscles needs to be strengthened so that the extra body weight is bypassed through the toned up muscles. So there is no pressure on the disc and there is no leakage of the chemicals through those annular tears, and patient can remain healthy forever if you utilize everything together. Thank you once again for giving attention to my presentation. Hope it would have served so much purpose for many people, and patients can contact me through Narayana Health. Thank you very much.